listener production.
Hi, Natarsha Belling with you and welcome to the afternoon edition of The Briefing. Coming up in our deep dive, the new call to give thousands of Australians living with mental health disorders the critical care and support they need. A new report shows those living with serious conditions like schizophrenia and depression don't qualify under current NDIS rules, seeing many slip through the cracks. We'll chat with the report's co-author on the concerning findings and the solutions. Those details in just a moment. But first, let's check the afternoon headlines this Tuesday, the 9th of December. The RBA has kept the official cash rate on hold this afternoon at 3.6% in the final board meeting of the year. It comes on the back of higher than expected inflation numbers, with some economists predicting this could be the end of a cut in rates. Here is RBA Governor Michelle Bullock.
We didn't explicitly consider the case for a rate rise at this meeting, but we did consider and discuss quite a lot the circumstances and what might need to happen if we were to decide that interest rates had to rise again at some point next year.
The United States will station more troops and military assets in Australia after AUSMIN talks in Washington. Foreign Minister Penny Wong and Defence Minister Richard Marles met with US Secretary of State Marco Rubio and Defence Secretary Pete Hegseth, confirming continued growth of the US military presence in Australia. Planned initiatives include upgrades at air bases in Queensland and the Northern Territory. Both nations reiterated AUKUS is moving, quote, full steam ahead, with officials signalling a broader push on defence, intelligence and critical minerals cooperation in the Indo-Pacific. Here is Defence Minister Richard Marles.
There will be further infrastructure investments at RAF Base Darwin, RAF Base Tyndall and RAF Base Amberley, which will support increased rotations of American military aircraft. That includes fighter planes, bombers and intelligence, surveillance and reconnaissance aircraft. And that builds on the existing rotations which are happening right now.
And Prime Minister Anthony Albanese has delivered the eulogy at the state funeral for former Labor power broker Graham Richardson. Hundreds gathered to farewell the controversial political figure, including Barnaby Joyce, former Prime Minister Tony Abbott, Joe Hockey and broadcaster Alan Jones. Here is the Prime Minister.
There was more to Graham than the long lunches and tall tales. He was nearly as much a Sydney landmark as the Harbour Bridge, yet one whose effect spanned the continent.
Richardson died aged 76 after a long battle with cancer. Now it's time to get into our deep dive on the concerning new report from the Grattan Institute about the number of Australians living with serious psychosocial disabilities. Advocates say there are solutions and proper support and care won't cost more, but the current NDIS funding system needs an urgent overhaul. Joining us is one of the co-authors of the report from the Grattan Institute, Rielly Polascheck. Rielly, thanks so much for joining us. Tell us about this new report and the research that you've found regarding some serious flaws or concerns within the NDIS.
Our report today is focused on the issue really of a huge amount of unmet need outside of the NDIS for disability or psychosocial supports. Despite Australia spending more than ever before, billions of dollars to support people who have significant psychosocial disability, more than 130,000 people don't get the support they need. And we're really concerned about that. It might be worth just as well defining what psychosocial disability is. It's not a particularly well understood term, and that's not at all surprising given it is used kind of distinctively in Australia, largely because of its inclusion in the NDIS. When we say psychosocial disability, we mean the disability that can arise from people's mental health challenges. So people facing really significant mental health challenges can find themselves with effectively experiencing a disability from that. So an example could be someone with schizophrenia. They might, as a result of the diagnosed condition of schizophrenia, have an impairment to their ability to emotionally regulate, which can cause them to have some really difficult challenges like maintaining and forming relationships, and at its worst could lead to social isolation.
So in regards, Rielly, to where the cracks are in the system, It seems that there wasn't a lot of evidence-based support or analysis when NDIS was first established. So therefore, these people aren't getting the support they exactly need. Is that correct?
Yeah, I think that that's fair to say. How we would consider it is that the NDIS, when it was designed, was really meant to be kind of the pointiest end, helping those with the highest level of needs. And so today it supports around 70,000 Australians, or almost 70,000 Australians who live with a significant psychosocial disability, which we think is absolutely appropriate. But the problem really is that there's a lack of alternative supports outside of the NDIS. So we see a huge number of Australians, over 130,000 Australians, who are unable to access the NDIS, but outside of the NDIS, there really isn't much support at all to go around. So I guess we see the problem as the broader system design, the NDIS picking up only a very few people, but a huge number of people with a really significant need, unable to cross the eligibility threshold for the NDIS, and then get left with no psychosocial support at all.
So what needs to happen from your research on how we can make the system work better? What needs to happen moving forward?
So we don't think that the problem is funding. There's not a problem with the amount of funding in the system. We think that there should be a rebalancing to address the kind of the inequities that are in the system today. We need a program of alternative supports outside of the NDIS that can meet the needs of the many over 100,000 Australians who miss out completely today. So we show in our report how a modest proportion of NDIS funds could be redirected to a new program, providing a budget of about $2 billion for the new program that would ensure that there's a consistent offering of evidence-based services for people with psychosocial disability, regardless of where they live and whether or not they meet the eligibility criteria of the NDIS.
So, Rielly, what would some of those evidence-based services be, and where is the evidence that they actually do make a huge difference? Because that's what we all want, is for people to receive the support that they need.
Yeah, that's a great question. So psychosocial supports, the kind of supports that we're talking about funding through a new program, are supports that help people to build social connections, learn the skills to manage their daily life or maintain stable housing. They're quite distinct from clinical mental health supports like seeing a psychiatrist or kind of managing medication. And there is a significant evidence base to show that these really work, even here in Australia. So prior to the NDIS, there were some of these programs. There are some still available today. They're by far not big enough, but we can see from the evidence that when these programs are offered, they can have really, really positive outcomes, both for the individual, lifting well-being, increasing kind of a sense of purpose and ability to maintain a kind of relationships in their life and stay connected in the community. There's also really important system level benefits because in helping people sort of improve their well-being, we're able to see results of where people have to interact with community mental health services less, have to go into the hospital less, and when they're in the hospital, often those stays are shorter, and reduced interactions with the criminal justice system as well. So incredibly important supports, and there is a strong evidence base that they work here in Australia.
Could you give us an example of some of those services, Rielly? Like where would we see them and what kind of benefits would it offer recipients?
There's a number of them offered today. Some of these services are offered through the NDIS, but also by the Commonwealth. There's a Commonwealth Psychosocial Support Program, and in states and territories. So in New South Wales, there's a program called CLS HASI, Community Living Supports and the Housing and Accommodation Support Initiative. That's a really great example of one that has got really strong evaluation evidence. So that would see people who have a significant psychosocial disability, so quite significant mental health challenges, and often that program particularly targets people who have had difficulty maintaining stable housing over their lifetime. And so they'll be supported to manage a tenancy, learn the skills of how to manage a tenancy, might be connected with peers who have gone through similar experiences. They'll have someone working with them to develop a recovery plan and then kind of be connected to the right supports to put that plan into place. So if they're wanting to reconnect with loved ones, if they're wanting to find and maintain a job, so on and so forth.
We've seen lots of coverage recently, Rielly, about many circumstances where people have suffered terribly from mental health conditions and have very sadly slipped through the system. And it seems that often we're always talking about actions after an event rather than preventative. How important are programs like this to not only offer these people suffering and living with mental illness the right support, but also as a society we all benefit from it?
Yeah, absolutely. That's why it's so important, and we shouldn't be waiting until people are sort of in a position where their mental health challenges have become so significant that they need support from the NDIS. We should be providing a wider net of supports that can prevent, reduce or delay the need to access more intensive supports like the NDIS. We know that people who suffer with or experience mental health challenges are more likely to be socially isolated, to lack support and connection in their own lives. And so it's really important that there are programs like the one that we're proposing there to help those people before they get into crisis.
So what would you like to see from the federal government in regards to what your report has found? What action would you like to see?
Yeah, we'd like to see the federal and the state and territory governments working together, committing to a plan to introduce a national program, what we would call the National Psychosocial Disability Program, outside of the NDIS that funds services, commissioned services for the 130,000 adults with significant psychosocial disability that miss out completely today. We think it's important that those governments work together to come to a solution so that incentives are aligned and that people can get the support they need no matter where they are in Australia.
We really appreciate your time and wishing you all the very best. Thanks so much, Rielly.
Thanks so much, Natarsha. Lovely to talk.
That was Rielly Polascheck from the Grattan Institute. And that's it for this episode of the afternoon edition of The Briefing. We'll be back tonight with the beefing on Sydney versus Melbourne. And we'd love you to subscribe or follow us on Instagram at The Briefing Podcast. I'm Natarsha Belling. Thanks for your company.